Hello friends, welcome back to our channel. This is Dr. Monica Kapoor from Dr. Kapoor's Dental Clinic. Today we take you through the journey of dental implant placement in another edition of implant patients in our clinic. As you can see, patient's lower right first molar is missing here. We evaluate bone status and all its measurement clinically as well as through X-ray or CBCT. Under local anesthesia, initial drilling is done by pilot drill to create a hole in the bone to prepare the site for implant. Drilling is done using the depth marking according to the implant length, which has been pre-planned based on the depth of the bone up to which we are going to place the implant. To reach this predetermined depth of the bone, sequential use of drills is being done. As you can see in the video, throughout the process, patient is being at ease and comfort. This is our final drill. Once this drilling process is complete, the implant placement is being done, checking the appropriate torque and stability of implant in the bone. Now, once the implant is placed in the prepared site, it is covered with a cover screw. This cover screw protects the implant during healing phase and allows the implant to osseointegrate during that phase. This healing phase will be around 2 months for this patient so that implant gets properly fused with the bone. Procedure has been done and as you can see, patient is completely at ease and happy after the procedure. For such clinical informative videos, do subscribe our channel and give support by your like and share. Thank you.